We had a lot of these patients with vascular anomalies that would come to the surgery clinic, but there was really not a coordinated way of taking care of them. And so not only was there not a centralized place for the patients, there also wasn't a group of physicians that were really concentrating on the care of them. It's very complex. The lesions have a really broad spectrum, and there's a lot of different ways of treating them. Some are very easily treated, some are more complex, but we didn't have a group of people that were really focusing on what's the best thing to do.
There's a lot of difficulty in terms of making the right diagnosis. You know, lots of times people are given misinformation or given an incorrect diagnosis when they have a vascular lesion or birthmark, and you know, that can really influence what is offered for treatment.
You can imagine that one, diagnosing it, getting the right imaging. These are complex problems. To give you an example, let's say if you had someone with an orbital lymphatic malformation, so a large lymphatic channel. You know, I know how to treat those with catheters and needles, but I don't know how to manage necessarily the ocular pressure.
The conference is, we have a radiologist, both a body and a neuroradiologist that look at all of our scans, and they'll review ultrasound, MRI, CT, any imaging that the patient's had, and then we all come together.
So our team is large, actually. So there's general surgeons, there's ear, nose, and throat surgeons, there's plastic surgeons.
Ophthalmology, dermatology, interventional, cardiology comes. Orthopedics comes if we need them to. We even have had neonatology and maternal fetal medicine for our prenatal diagnosed patients. So we all come together and we talk about every single patient that we see in the clinic so that everyone sees an image of the patient that has been sent over by the parents. Everybody looks at the imaging, so it's not just one person making an assessment of the imaging, but we're all looking at it. And then we talk about the treatment options.
Conference is extremely important because that is the setting where we all kind of hear about the information we have about the patients, and we look at whatever imaging they've had, and we all get to give our input about what we see and what our own experiences are, because we've all seen different patients and we all have different levels of experience and we all have a different angle, you know, that we're thinking about the patients from. So for all of us to be able to come together and have that discussion, I think is really important, and the patients and their families really benefit from that.
You name it. If you have a vascular anomaly anywhere in your body, we have a group of doctors that can help take care of them.